y'all, my name is Noah Wilkins. I'm a senior with the nuclear medicine program here at Old Dominion. The nuclear medicine program is really unique in the fact that it's a small niche and we're all really good friends and really get to know each other and learn from each other. As well as the nuclear medicine program, I'm also a swimmer here at Old Dominion, which is kind of similar to our nuclear medicine program because just like the nuclear medicine program, I get to learn and train and swim with all of my really good friends. Uh, let's take a tour of our nuclear medicine lab.
My name is Mayweather, and I'm a graduating senior. I think one of my favorite scans during my clinical rotation has been renal scans with Lasix. And what we do is we inject the radioactive isotope called Materitide, and basically it goes straight to your kidneys, and we're able to see the function of your kidneys. And even though everyone has the same kidneys in their bodies, it's cool to see how everyone is different in their own unique way. Some kidneys are full of stones, some kidneys don't work, and that's the whole purpose of our major overall is for diagnostic purposes and just seeing how your body functions. In a normal day, this is a dose calibrator. I know it's kind of far away, but I consider this like the heart of what we do because before you can meet with patients, before you can administer any type of pharmaceutical, you have to go ahead and measure out like to make sure that your dose is correct for the day because you don't want to inject the patient with the wrong isotope or the wrong dosage for them. So it just comes in this nice fancy syringe shield, and you just go ahead and it's not gonna fit, or it may, and you pop it in, and then a little number will pop on the screen, and then you get your dose. And then you always want to make sure that you write that dose down so that you know what you gave to that patient for, I guess, safety protocol purposes. And then go ahead and put your syringe shield on it, and you're good to inject.
This is one of the generators that we use to elute some of our radiopharmaceuticals when we're, in the lab or out in the field. What we would do is we would have a vial of saline, and we would attach it to one end and an empty vial on the other. And when the vial runs through, it runs through a radioactive source in the middle of the generator. And when it comes back up, the empty bottle of saline will have our radiopharmaceutical that we can use to inject or to use for other sources in the hot lab and in the department. After we elute our generator and get our source, we're able to administer it to patients. And once we administer it to patients, we're able to look at disease and other functions of the body to kind of tell what's going on.
So another part of our hot lab consists of this L block. As you can see, it says caution, radioactive materials. So whenever you're dealing with any type of pharmaceutical or anything of that nature, you always want to make sure that you're practicing your time, distance, and shielding, also known as like it helps with your ALARA, which means as low as reasonably achievable. It just helps to minimize the exposure that you get because you are working with radioactive isotopes throughout the whole entire day. So the more you practice your safety and shielding, the better it'll be when your dose reports come back annually or semi-annually or quarterly, however it works for you. And just always handle everything behind here, and there's a nice clear glass so you can see.
This is one of the instruments that we would use in the clinics in the nuclear medicine department. It's used to count radioactive iodine. It usually gets uptaken in the thyroid once you swallow a radioactive pill.
So how it goes as a patient is when before you come for a nuclear scan, you always get a call from a tech or one of your doctors about prep. So for thyroid scans, there's always patient prep that's included, such as fasting, not eating, making sure you're not taking any of your thyroid medication. Also, make sure you're not taking vitamins because the thyroid is actually very sensitive. So as a patient, it's always good to make sure that you're following any protocol that's given to you.
This is another one of our instruments that we use in the hospital just to kind of detect radiation all around us. And radiation is actually all around us, and this cup right here is actually radioactive, as you can hear. And it's just used for a baseline, make sure that we know that the meter's working just fine because we know that that is radioactive.